16. Okay. Start. In preclinical work, all steps we have covered. Okay, as far as your second year is concerned, all lab steps before coming to your clinics. Okay, all lab steps we have performed in the clinics. Okay, now as far as your third year is concerned, we are going to fabricate a prosthesis in third year. Which is that prosthesis? That is your complete denture prosthesis. Whenever you replace all teeth for a patient, okay, keep it in mind
Power
that whenever you replace all teeth for a patient, means you are doing a full mouth rehabilitation case. Whatever may be the prosthesis, it can be a fixed type of prosthesis or it can be a removable type of prosthesis. Okay, you are doing a full mouth rehabilitation for that patient, and here you are doing rehabilitation, full mouth rehab in the form of your removable prosthesis, that is your complete denture. Okay, so which steps you are going to perform during your clinics? All of you know that there are some clinical steps and there are some lab steps. Okay, so which are clinical steps? Primarily, there are 5 important clinical steps. Which are those? First is your primary impression, then secondary impression, third is your jaw relation, fourth is your trying, and last, fifth step is your denture insertion step. Whenever somebody asks, tell me about steps in denture fabrication, that time you have to tell these 5 important steps. Along with that, actually you have to start with your case history taking. Your history taking must be your first step and your follow-up should be your last step. So don't forget these 2 important steps. Okay, but at least 5 steps you should know. Okay, coming towards the primary impression. Okay, what do we do in primary impression? See here. What they are showing here? They are showing a picture showing a maxillary edentulous impression and mandibular edentulous impression. See, in this image, they are showing that they have used this compound as an impression material for making primary impression. Always use the word to make an impression. We don't take the impression, we make the impression as far as our structures, tissue structures are present. As far as the foundation area is present, we record that impression or we make that impression. Okay, so what you are seeing in primary impression, see all borders are round. Means what? All these borders are nothing but your vestibule. Okay, and or peripheral structures means this border area is recorded well properly. Okay, and this is your extension area, means your extension, posterior extension, that is the PPS area is well recorded. The PPS again here, the PPS is marked here also very well. Okay, so as far as your primary impression is concerned, we have to record it with your compound. Whenever there is a good rich patient or edentulous good rich patient, we make impression with the help of a compound. All of you handle compound. Okay. After making a primary impression, we pour this primary impression into the plaster. See, now here they have poured in stone. So there are some images in this presentation which are actually which are wrong. Why I have inserted wrong images here? Because you should be attentive that this picture is wrong, this picture is wrong. All images are taken from net. Okay, so whatever Google showing you, image for your diagnostic cost or image for your primary impression, all images are not there. For that, you should read the textbooks. Already, you should read the books, and accordingly we have to perform. Okay, so this primary impression, we pour it in plaster to fabricate a diagnostic cast. As far as your preclinics is concerned, we have given you, or we have provided you molds. Okay, and in that mold, we pour stone to fabricate our master cast. Means what? This primary impression step you have missed in your preclinical work. Okay, so here we do beading boxing to this primary impression. Okay, and pour nicely diagnostic cast. So as far as your diagnostic cast is concerned, what is important in this diagnostic cast? This is fabricated for diagnostic purpose only. To understand how our ridge form is, how the ridge is, how the pattern of resorption on that ridge, all these things we have to just vaguely, you should know that how is my foundation area. For that purpose, we fabricate a diagnostic cast. And the second most important thing or use for this diagnostic cast is fabrication of your custom tray. Now, on this diagnostic cast here, we fabricate a fine custom tray. Okay, here this diagnostic cast is covered with spacer wax. Okay, there are different spacer designs. Okay, among different spacer designs, we follow Boucher's full spacer design. Okay, and we fabricate a custom tray on the diagnostic cast. Okay, now the thing which is wrong in this custom tray is, as far as this is a metal cast is concerned, okay, the custom tray's handle should be at the 45-degree angulation. It should be 45-degree angulation, and in this diagram they are showing that this handle is in horizontal direction. What happens if we prepare a handle like this? They will interfere in your anterior maxillary vestibule area. They interfere with your lip. And why we give 45-degree angulations? It represents the position of your central incisor. And whenever you are going to insert the custom tray in patient's mouth, you will come to know how the aesthetic of the patient is. Okay, for that purpose, we prepare a handle at 45-degree angulation. After this custom tray fabrication, what is the next step? Next step is our recording final impression. Okay, we just trim this custom tray periphery 2 mm to create a space for our green stick compound. We adapt green stick in this area and we do bore molding area by areas. Okay, and we record a final impression. Okay, we record final impression with the help of this custom. So this picture is concerned. In this picture, they have recorded the final impression in light body. We record final impression in zinc oxide eugenol paste. Okay. All borders of our custom tray we have molded properly with the help of our green stick compound. Okay. And afterward, we just remove that spacer to create a space for our impression material and make a good final impression. What is the difference between your primary impression and your final impression? See here, all frenums, all your border structures, all your vestibule area are finely recorded here. All your landmarks are set properly in this final impression. And this final impression we pour incidental stone to fabricate a master cast. This is a master cast. Now in pre-clinics we have just skip these two steps. Just we have skipped these two steps and we have provided directly a master cast to you to do preclinical work. Okay, but we have to perform these two steps in your clinics. Okay, so as far as this master cast is concerned, basically you should know the proper dimension of this master cast. Okay, all impression area, all foundation area should be evaluated properly. Okay, afterwards on this master cast we fabricate record basis. Which basic things you should know about record base? Record base should be rigid enough to bear massivity force. It should be stable. It should be properly extended. Thickness at least 2 mm. Borders should be round, overall round borders. How to check our borders are round or not? Just move your fingers on the borders of your tray or your record base. The same criteria you have to apply for your custom tray also. Because whenever you are going to insert it in patient's mouth, if we feel a roughness on your finger, that means there is a chance to tear intraoral mucosa on patient's mouth. Okay, for that purpose, whenever you are going to insert anything in patient's mouth, it can be a custom tray, it can be a record base, it can be a trial denture, it can be a final denture. Always try to check, feel the borders of your prosthesis. Always with the help of your external surface of your hand. Okay. After making of your record bases, you just prepare a good wax occlusion rims. I am pressing on the word occlusion rims. It's not an occlusion rim. The right correct word is occlusion rims. The fabrication of your occlusion rims on record bases. Nicely they have prepared a maxillary wax occlusion rim and mandibular wax occlusion. So this is again your pre-clinical work. This is your lab work. After fabrication of this wax occlusion rims, the third clinical step we are going to perform, that is your jaw relation. See, as far as your jaw relation is concerned, it is again divided into three types. One is your orientation relation, Second is your vertical relation, and third is your horizontal relation. Okay, what is orientation relation? In orientation relation, how the maxilla of the patient is oriented with the base of skull. First we find and how the maxilla, because every patient, the maxilla is oriented differently for every patient. So just we have to record and we have to transfer the relation of maxilla to base of skull on articulator. So all the process of your orientation relation is to record your maxilla, base of skull, and transfer it on your articulator. Okay. In vertical relation, we record vertical dimension at rest, vertical dimension at occlusion, and the proper fluid space. Okay, and in horizontal relation, we record a centric relation. What is centric relation? A centric relation is nothing but the most posteriormost position of your mandible maxilla. Why we record centric relation? Because it's a starting point for your any mandibular movement, and it is a stable and repeatable, reproducible position or point. That's why we record centric relation. After recording of your jaw relation, we transfer this whole trial denture on the articulator. The maxillary wax occlusion ring, the mandibular wax occlusion ring. In total, we have just seen intraorally in patient's mouth, and in total, we remove from patient's mouth and transfer it on articulator. So this is an another type of articulator. We have just transferred this into articulator, and we have to done the mounting on articulator to maintain the dimensions which we have recorded in during our jaw relation. After mounting on articulator, we know we arrange all the teeth like this, and a nicely trial denture, fabricated arranged trial denture we prepare. After this teeth arrangement, we coming towards the fourth stage, that is step, that is your trying. In trying, we insert both maxillary and mandibular trial denture in patient's mouth. We check for occlusion, retention, stability, support. Okay. And afterwards, we do de-waxing and packing. As far as de-waxing is concerned, boiling should be at least for 10 minutes. Not more than 10 minutes and not less than 10 minutes. Okay. In boiling water, we have to keep our flask for at least 10 minutes. Okay. To remove or to eliminate all the wax. All you have prepared, all you have done this packing stage. Okay. And after retrieval, after packing, curing and retrieval of your denture. Afterwards, we do finishing polishing to remove all the excess flash which is present. Okay, and the last step is our denture insertion. Here again we insert the well polished finished denture in patient's mouth. Okay, so this is an introductory lecture for your third years third year's work or clinical work. Okay, so basically this is an outline. So what we are going to conduct, or we are going to take in detail about in future lectures. Okay, so starting from our history taking, I think Rajra sir is taking uh, history, or he will take half portion of these steps. I will take half portion, or I will continue all these steps. Okay, but from your primary impression to your denture insertion. Okay, making of primary impression, making of secondary impression, making of your recording of your jaw relation, the drying process, the denture insertion process. Okay, all these steps we are going to learn in detail. Before touching to the patient, you should know all theoretical knowledge regarding your complete denture prosthesis. Okay, so we will stop here. Okay, thank you.